Hello, hello. Good afternoon, everyone. Good Friday afternoon. We are back again for another episode of Focus on It Fridays with Dr. Brandi B. Come on in, and we will give everyone about 3 or so minutes to come in and join us. Today's topic, hello, Cousin Latina. Thanks for joining. Today's topic is going to be, who do you turn to for mental health treatment? And what can those persons offer you? Hello, Melanie. Thanks for joining. It is a lovely Friday. We've had some great Fridays here, so that's been exciting. A great time to talk about some mental health treatment. Hello, Sis Erica. Thanks for joining. You all are now like my loyal watchers. I appreciate that. Come on in, like and share the video so that other people can know about what's going on, because certainly they are going to want to hear this information. People are already asking you this information anyway, so they may as well get it here, have a chance to ask some questions, and know exactly what is going on. Again, I am Dr. Brandi B, and we're going to be talking today about mental health treatment. Who do you go for? Who do you go to? Who do you see? And what should you expect from them? What sort of things should you be looking for in any mental health provider that you may be searching for, or that you may have the opportunity to see? So come on in. Let's, we'll wait just a few more moments for some others to join us, and then we're going to have a lot of fun. I'm so excited. I love talking about mental health. So exciting. I hope everyone is having a good Friday. Like I said, it's a beautiful day. It rained a great part of last week, not so much this week, but it's nice to have some sunshine outside. Hello, Raina. Thanks for joining. Go ahead and share and like the video. Make sure other people can see it. All of your friends want to know this information. They're asking you anyway, so we may as well go ahead and let them see it here and hear it here. If you have any questions, you can go ahead and put them in the chat. I will try to get to those as we go along. But certainly, if I do not see your question, or if you have one after I have logged off, then I will make sure I address that as well. Thank you all for joining me on your Friday. And it's 12:03, so we will go ahead and get started. Again, I am Dr. Brandi B, your triple board certified child and adolescent psychiatrist. I help worried, overworked, overwhelmed, and plain old tired moms of kids with ADHD and any mental health disorder to gain the encouragement they need, the empowerment they need, the education that they need, so that they can help their children also become empowered, be well behaved, and be better in the classroom, and be successful in life. Today's topic is, so I've decided that I'm going to see a mental health professional. Who do I go to see now? Hey, Cousin Karen and Auntie Rosalind, thanks for joining. So, as I mentioned in my introduction, I am Dr. Brandi B, and I'm an ADHD expert. Hello, Jaquetta, thanks for joining us. So, ADHD, let's just talk about that for a while. We won't talk about it a whole lot today, but I do want to just kind of throw it out there. School is about to come in session, all right? There is so much going on around. Should schools start back? Should they not? I don't know, but I do know this. If your child had trouble struggling, all right, last semester at home with you, and you know it because you were their teacher, then I want you to think long and hard about, did you have to stay on that kid to stay focused? Did you have to remind that child to sit back at their desk, to not talk, to stay in their seat, to not blurt, to not interrupt, to not jump, to not fidget, to not chew on their shirt, to not twirl their jeans, to not be so disorganized? So in other words, to get organized, to keep their room organized, to keep their room straight, to finish tasks that they actually start, if they ever start them. If you ever had to do those things and you were like, oh my goodness, this teacher was telling me the truth, then you may want to consider ADHD. Of course, kids are normal and they move normally. You may even hear my kids start to bang on the door. Who knows? Anything may happen on these lives, because I'm a real life mama as well as a real life doctor. So kids do things like that. That is completely normal. But we just have to make sure that if it is interfering with their ability to function academically, socially, or even for the adults, occupationally, that may be something that we want to consider treating. There are medications to treat it. And honestly, I don't care what you're going to hear, what you're going to say. You have not heard me say this to this point. Medications really are the gold standard. There's nothing like making a list to help you remember something and then forgetting the list, all right? So I just wanted to put that out there about ADHD. So as we prepare to go back to school and we're remembering our masks and we're remembering our shields and gloves and whatever else it is that we are doing and we're praying about it, please make sure that you are in prayer about treating your children's ADHD. All right, so now let's just jump right in. Let's just say that you're like, you know what, Dr. Brandi B, my child does have ADHD, but what do I do next? And I'm so glad you asked. You probably hear terms like psychiatrist, psychologist, therapist, counselor. You probably hear things like my pastor's doing group study. You probably hear things like I'm just going to pray about it. And all of these are good things and they are not necessarily mutually exclusive, which means that you can do all of them at the same time. You can see your pastor and pray. You can pray alone. You can pray with your mate. You can pray with your mom. You can be a pastor and even pray and still get therapy yourself, okay? I have been known to pray with my patients, to even cry with them, because sometimes things are just kind of sad. And because I'm human, and because I'm a mom, and because I'm a wife, and because I'm a daughter, I get it. All right, I get it. So let's just jump right in and start. I'm going to start with the term therapist, and I have some notes so that I can make sure that I stay on track, because I get excited and I know I'll go off. So let's talk about therapists. Who are therapists? Everybody that I'm going to mention will have had to go to college. College is going to be a requisite and some sort of licensure or testing to prove that what you learned in college and beyond, you actually know how to apply it. So that's a good thing, right? Nobody likes tests, but really that's what we have in America to say that what you studied all those years, you actually mastered. So your counselor or your therapist, sometimes used interchangeably, is going to be someone who went to college for 4 years, all right? Then they have a master's. Master's is going to be roughly about 2 years. After that time, they're going to spend another 2 to 3 years under someone else's study who is already in the field. That person will be able to discuss cases with them at a set amount of time that is set, by their boards or licensing agency, that they will have to go and discuss a certain number of cases with that person to make sure that their line of thinking is correct, okay? They are called LPCs, and so they are going to be licensed professional counselor. That is what LPC is. And so they are going to be able to help you in talking. It's called talk therapy, okay? So there's many types of therapy. So when people are in rehab or in therapy, we need to know, the first thing you want to know is what kind of therapy they're in, what kind of rehab. So I'm talking about talk therapy. Everything today is going to be talk therapy, okay? So that's your counselor or therapist. 4 years of college to however many years it takes them to get a master's. They must have a master's, and then they're going to be an LPC, licensed professional counselor. Okay. Now, you may also find that social workers are doing therapy. All right. So your social workers are going to, again, have 4 years of college. It may be a social work degree that they have, and then they're going to have a master's. It could be in social work. It could be in therapy. It could be in psychology, but they must have a master's, and they too must have licensure. Usually they're going to have an LCSW, which is a licensed clinical social worker. They must have that in order to see you and do talk therapy. Otherwise, a social worker can help you to find resources that you may need. So if you need a wheelchair for your child, if you need crutches as you're being discharged from the hospital, that would be what a social worker could do who does not have the licensed clinical social work licensure. Okay, they otherwise cannot do therapy, so they must have that. All right. We will go on now to nurses. There are some nurses who can do therapy. And that is nurses just in general. They may be also able to help you with establishing, getting you connected with resources and being a liaison for you. And then we also have CRNPs, which are Certified Registered Nurse Practitioners. Now, shortened to be nurse practitioners, these are nurses with advanced degrees. So they function independently in their decision making and can also do therapy and also prescribe medications. But they are still under, in most states in the United States, they are still under the supervision of a medical doctor. Okay, so a certified registered nurse practitioner or nurse practitioner can practice independently, but they are still under the observation, if you will, to a certain extent of a medical doctor. And depending upon how far they are from their training and from graduating, that will dictate how often they have to meet with the medical doctor under whose license they practice. The relationship between a certified registered nurse practitioner and a medical doctor is called a collaboration. They collaborate, or they have a collaborative agreement. And that is, again, with a physician and with a nurse practitioner. Now, what gets confusing to some people is when a nurse has a terminal degree, which is a doctorate. He or she at that point is and can be called doctor, whatever their name is. And what gets confusing is that a lot of people will say, I see Dr. So-and-so. So they are doctor in that they have earned a doctorate degree in nursing. But most people do not understand that they are not a doctor in the sense that most people think of a medical doctor, one who has an MD or a DO. All right. So you may call them doctor by their name, but they are a nurse with a terminal degree. They can still prescribe medications. And whether or not they are able to prescribe controlled medications just simply depends on the state, how long they've been out of practice, and whether or not they have their DEA. Having a DEA is so very important. All right, so we've talked about counselors or therapists and their degrees. We've talked about social workers and their degrees. We've talked about nurses and nurse practitioners. Okay, now let's talk a little bit about medical doctors, since I've already touched upon them while talking about nurse practitioners. So medical doctors are what most people think of when they think of doctor, okay? So medical doctors or psychiatrists, T-R-I-S-T, psychiatrists like me. I'm a medical doctor. I have my MD or medical doctorate, okay? So I am a doctor of medicine. Medical doctors have gone to college for 4 years, and these are just typical numbers, okay? College for 4 years, and then medical school for 4 years. And then to become a psychiatrist, you must do 1 year of an internship, which is just general medicine, either pediatrics or adult medicine, which is called internal medicine. And then from there, you go into 3 years of your adult psychiatry residency. All right, so 4 years of college, 4 years of med school, 1 year of an internship in general medicine, and then 3 years of your psychiatry residency. That's adult psychiatry. Once you finish doing your adult psychiatry, and I'm going to specifically talk about psychiatrist, okay? Once you finish your residency in adult psychiatrist, then you can do a fellowship. Doing a fellowship or being a fellow means that you have completed successfully, and sometimes even passed the board, depending upon where you are in the year of training, a general residency. So in this case, a general residency in psychiatry, adult psychiatry. Then you can go on to do a fellowship in a subspecialty. So you can do child and adolescent psychiatry, you can do forensic psychiatry, you can do substance abuse. There are all sorts of subspecialties of adult psychiatry. So any person who says, I'm a child and adolescent psychiatry, I'm a forensic psychiatrist, those people have completed a general adult psychiatry and probably have passed the board and then gone on to take their other boards after completing that fellowship. Fellowship gets a little bit tricky, but fellows are simply persons who have gone to extra training to be subspecialized and to serve a specific population. Now, I am a little bit different in that my goal was initially to become a pediatrician. And so I kept that goal and completed it. And so I did a program that was 5 years where I earned a pediatrics training, adult psychiatry training, and child and adolescent training, psychiatry training. So that would have been 3 years for pediatrics, 4 years for adult psychiatry, and another 2 years for child and adolescent psychiatry. So whatever that math works out to be, I did all of that in 5 years, and I actually boarded in all 3 specialties. While we're here, let's just talk about whether or not your psychiatrist or your physician in general is board certified. When we say that we are board certified, that means that we have gone through the rigors of paying money for, studying for, and in my case, sitting to either bubble in circles or click on the computer, as well as do oral examinations. So at that point, our college, med school, and then our residency training has all been standardized because we have taken the test that every other person who is in that specific specialty or subspecialty has taken. So we have the right to say we took the test, we passed it, and we are board certified in that area. We are true experts. Now, you should know that there are certainly smart and competent physicians, including psychiatrists, who never sat for their boards or some who never passed. That does not mean that they are any less smart or any less capable. It just means that they either didn't sit for the test or just maybe weren't good test takers, maybe had a bad day on the test. But for whatever reason, they did not become board certified. That does not have much to say about their abilities and skill as a physician. You should also know that at an academic institution, for example, like here at UAB, Children's Hospital, things of that nature, most of your physicians are going to be board certified, and that only makes sense. They are the people who are assigned to train new and upcoming physicians. So certainly we would want them to have passed the test so that they can at least tell others what some of the things are that are pertinent to passing. But I do want you to hear me loud and clear that if your physician is not board certified, that may or may not dictate just how good they are as a physician, because certainly bedside manner is not something that's always able to be picked up on a standardized test, okay? And a good test taker even can get that question right, all right? So let's talk about a little bit more about what a psychiatrist does that's going to be different from all the other people that we have mentioned, all the other types of mental health providers we have mentioned. First of all, again, let me tell you loud and clear, a psychiatrist is a medical doctor. I can't tell you how many times I hear, well, I'm just going to go see my real doctor. Now, I don't get offended because I know what I do and I'm confident in who I am and what I do. But your psychiatrist is a medical doctor, okay? I may not look in your ears, but I remember still what an ear looks like. And when I've been called upon to do that, I have. One of the important things about a psychiatrist as a medical doctor, and not just a mental health professional, is that part of what we need to do when we're listening is to figure out, is this a medical problem or is this a mental health problem? So if someone were to come into my office with big eyes, this area here is sticking way out, they're talking a mile a minute, they're fidgeting and they can't sit still, they're sweating. Now, someone just on the street may say, oh my goodness, that person is manic. Mania this is an aside, is a part of bipolar disorder. So someone may say this person is manic, but your psychiatrist with their background as a medical doctor should immediately say they may be manic, but because they have big eyes, a protruding goiter, one of the first things that I'm going to think of and I will need to rule out is going to be hyperthyroidism, okay? So until I can rule out hyperthyroidism, in this patient, it would absolutely be inappropriate for me to put them on lithium, for example, to treat their bipolar disorder. And so your psychologist and your other mental health providers are going to be able to pick up on that as well. But your physician right away should always be thinking, could this be medical? Could this be medical? There are certainly several medical lookalikes, as I call them. And so you should be, or your provider, your doctor, your psychiatrist should be able to figure out what those are. Let me just tell you a few since we're here. A few of the lookalikes for ADHD, I have picked up on children who have learning disorders, okay? So nobody likes the term special education. But if your child is up here and the rest of the class is at average, but your child has been there, done that, and knew all that, put them before you ever put them in school, then your child may be advanced. And so they are not going to want to sit in class with kids who are not able to perform at the level that they are. That kid is going to fidget, flip around, move around, look out, okay? So that's one thing. On the other end, the child who has trouble learning, okay, who may need some special assistance. That child is also could present with fidgeting behaviors, not staying focused, that sort of thing. When we think about neurologic problems, a child with ADHD could have absent seizures. Absent seizures is something that happens when a child just kind of stares off into space. They could be talking, then all of a sudden, they just come back and they start talking again. There are some ways that we can diagnose that in the office, but of course an EEG and a follow-up with a neurologist would be the true way to go about doing that. There are some kids that I've even known who had anxiety. Anxiety can look a lot like ADHD. Kids can also have ADHD and anxiety at the same time. I've even had some kids who had constipation. That was a weird one, but it's not uncommon. I've seen it on more than one occasion where a child comes in, I just take some history, and then we find out, let's treat this child's constipation first, and then we can look at what remains, okay? So those are just some things that your medical doctor is going to be able to do, and they should be doing in order to make sure that what we're dealing with is truly a mental health disorder and not a look-alike that is strictly medical in nature. It's also important for you to hear, though, that you can have medical problems as well as mental health problems. One good example is non-epileptiform seizures, and this is not related to ADHD, but people who have seizure disorders can also have seizure-like activity that does not have the EEG findings that would support that movement. And those are very difficult to treat, but talk therapy is a part of that treatment. To everyone that's come in, I've been in the groove. Right here on my screen, I see Miss Luella, Miss Ware, Auntie Gail, and Miss Thelma. Thank you all for joining me. If you are here and this is good information for you, go ahead and please like it, share it, leave me some comments. I will try to address questions as I can see them. All right. So now, still talking about psychiatrists. We have learned that they are medical doctors. They've gone to medical school. They've gone to a residency, and then they've gone to a fellowship. They've passed some boards, maybe, maybe not. We talked about what that board certification means. We have also gone off a little bit and even talked about why psychiatrists are different from the other type of mental health providers. They can look at what your presenting symptoms are and even what you're telling us, because remember, in all of this, history is the most important thing. I do a lot of what I do just by listening. And so that's why it's very important for me when you walk into my office after we exchange niceties and we get to know each other and I introduce myself and you introduce myself, I ask you a question and I just let you talk. And then before I start talking, I said, are you done? Because once I start talking, I am like I am now. This is me on every single meeting. And if your doctor does not have time to teach you, then, that is something that you definitely need to consider. Dr. Brandi B will be happy to teach you, but you definitely need to be in a situation where you are being taught, because to be honest, many of us just don't know. All right. We just don't know. All right. Thank you, Auntie Rosalind. Thank you. And thanks, Mom. Miss Diane, thanks for joining. All right, so what else can your psychiatrist do? Your psychiatrist can keep a hold of and is expected to monitor your vital signs, all right? Because again, we are physicians. If you leave here knowing nothing else, know this, a psychiatrist is a physician, okay? We are medical doctors, all right? So they should be taking things like vital signs. They should be checking your weight. Because one of the things, as far as me, again, an ADHD specialist, stimulant medications, and when I say stimulants, those are going to be things like Concerta, Ritalin, Vyvanse, Focalin, Adderall. All of those things can affect your blood pressure, so I need to be able to take that, and I need to be able to know what those numbers mean. Anybody can take a blood pressure, but not everyone knows what those numbers mean, and if we can wait, if we can hold a dose, so that is what I need to do. Stimulant medications can affect your heart rate. Stimulant medications can cause seizures. Stimulant medications can make you lose weight, okay? Some other medications may cause you to gain weight. Some other medications may impact your red blood cells or your white blood cells. And so I need to be able to know what to order and what those values mean when they come back, all right? So that is something that your medical doctor should be able to do, your psychiatrist. And then lastly, most people are coming to psychiatrists because they need medicine, all right? And so your psychiatrist should be able to listen, make a diagnosis, determine if medications are appropriate, and then what I do is ask you, do you want them? You will never come and see me and I tell you what we're going to do. I tell you what the options are. I explain the benefits and the side effects, and then anybody who sees me knows that Dr. Brandi is going to say, what would you like to do? Now it's your time to talk again. So you talk, then I talk, then you talk, and there's usually some exchange. And if your doctor, if you find that you don't get a chance to talk, that's an interesting relationship, because what we have as mental health providers is a relationship with our patients. It's not a dictatorship. It's a relationship. We go back and forth. Hi, Priscilla. Thanks for joining, sis. All right. So I think I've told you a whole lot about psychiatrists. All right. But there's still one class of mental health providers that's very important that I think we need to talk about. All right. And those are psychologists. Psychologists. All right. Now, psychologists are PhDs, so they can be called doctor. Remember, I told you and I hinted on it, but a terminal degree means you come to the end. Terminal, the end. So that degree is going to usually end with a D or have a D in it. Psychologists are either PhDs or PsyD, which is usually abbreviated PSY, big D, or EDDs, which are big E, little d, big D, okay? Other terminal degrees are MDs, like me, DOs, which is the other type of physician, JDs, like my husband, Doctor of Jurisprudence. Those are your attorneys, but they are doctors, okay? Nobody calls them doctors because once they pass their certifying board, we call them attorney. We don't call them doctor. Let's see, who else? Your DDSs are your dentists. That is a terminal degree. So anytime you see a D in the name, it's probably going to be a doctor and it's probably going to be a terminal degree. Now, let me come back. Psychologist. Psych D, PhD, and sometimes EDD is mostly what you're going to see in the United States. Now, psychologists can do therapy. They can do testing. And I use them a lot for testing, okay? Now, why is testing important? Sometimes when parents are talking to me and I'm listening intently to try to figure out what is the diagnosis, do we need medicine, what's a good medicine for this particular child? And sometimes it's just not very clear. That does not happen often because I have scales and I've been doing it for a while and have seen so many children and adults that I know what I'm listening for. But sometimes you can only get as much history as your historian will give you. So if I do not have someone who is either able to give me a good history, or they've had a stroke and they can't remember, or we're in a situation where we have a foster parent who got the kid when they were 6 and I'm trying to figure out about autism and I really need to know about what was that child's development like, then I will send my patient who is in front of me to a psychologist so that we can get psychological testing and then we can confirm the diagnosis. Now, psychiatrists can do testing as well, but usually psychiatrists are going to be prescribing and or doing therapy, but we do not do a lot of testing. And that is just the nature of how it is. Now, one example may be if you find a psychiatrist who, y'all hear my son knock, Franklin, I'll be with you in just a second. That was Franklin, my 4-year-old. Sorry about that. I told y'all I'm a real life mom and I'm at my home like most moms and their kids are these days. So I do apologize. But continuing, most psychiatrists are not going to do testing and we will refer to a psychologist. The one caveat, the one exception may be the psychiatrist who works in an academic setting. They may be doing some testing, but usually you're going to find that the psychiatrist will refer. Okay, so your psychologist is going to be doing testing and they're going to be doing therapy. All right. Now, one way that I can think of to remember the difference between a psychologist and a psychiatrist is that psychologists get the gist of medicines, but they can't prescribe them. All right. Hopefully that helps y'all. Y'all know I'm big on mnemonics and memory aids. They get the gist, but they can't prescribe medicines, at least not in most states. They get the gist, but they can't prescribe. Psychologists get the gist, but they can't prescribe. All right. So now we are moving on. Hopefully that's been helpful. All right. So we've got, in summary, we have counselors and therapists, mastered level, not doctors. They can diagnose, they can do therapy. We've got social workers. They have to be licensed just like the counselors, and they are not doctors, but they can diagnose and do therapy. We have nurses who, depending upon their training, can do therapy, and if they are certified registered nurse practitioners, can also treat, okay, make treatments and prescribe. A certified registered nurse practitioner or nurse practitioner, despite their degree, they are not doctors, even though they have a doctorate. Isn't that confusing? But they're going to work under a physician, even if you've never seen that physician or heard of their name. There is a physician somewhere who they collaborate with. Collaborate is the word, okay? And they can do therapy, they can prescribe, they can be a liaison and connect you with other services. All right, then you've got your psychiatrist, who is a medical doctor, who is responsible for making sure that your vital signs are steady and is responsible for making sure that your mental health presentation is not a lookalike for something medical. All right, and making sure that that is worked up. They may work it up. I feel quite comfortable working up a lot of things, but I'm also a pediatrician. All right, so I feel quite comfortable at least getting the labs done and then referring you to the next person. For example, I mentioned absent seizures. If you're staring off, I'm going to send you to a neurologist. If you are, having a lot of palpitations, which is fast heartbeat, and you're coming to me for panic attacks, I may need to make sure that you aren't having some cardiac issues or heart issues, especially if you told me that all the women in your family just dropped dead by the age of 40. I'm not going to be comfortable with that. I don't care how old you are until we get cardiology involved. Thanks for joining, Miss Young. Sorry I had to hang you up. Thanks for joining me, though. You all share it like this if you all are getting some great information today, and I hope you are. All right. So those are going to be things that your psychiatrist can do. And of course, we can prescribe medications. Let me just, oh boy, stick this right here. Okay. If you are seeing a child psychiatrist for your child, and you find that you are unloading on your child psychiatrist your own personal issues, please hear me loud and clear when I tell you that you should get your own, okay? That is not the time nor the place for you to seek mental health treatment with your child's psychiatrist, all right? I'm just going to say that. And it is my firm belief that any parent any person can use mental health treatment, some therapy. Good therapy is good for the soul. But if you have a child with a special need, and that need could be something as simple as ADHD, or it could be something, as significant as having a child who needs 24-hour care. You need to be in some therapy, because there are some things that are going on with you that it's a lot. Parenting is a lot. You all just heard my son knocking on the door. And the last time I was talking about oppositional defiant disorder, I think all three of them were banging. That can be very stressful, but I've got a lot of help. I have a lot of resources, I have an amazing husband. Things are in place that can decrease the stress for me. But if you are in and out of the hospital with your child, if you don't have a lot of help, if you don't have a lot of resources, it's a lot. And it's okay for it to be a lot. I want you to hear me loud and clear that psychiatrists are physicians, and that it's okay to seek some mental health treatment. Don't make me do this all by myself. Go get some mental health treatment, please. Like, I don't beg much, but please, if this is pouring on your heart, go and do it. Today is the day for you to go and do it. All right, let me get back to where I was. I'm sorry. Let me get off my soapbox. So we talked about that, and then your psychologist is going to be someone who can do some testing and do some therapy. All right, now real quick. Okay, I've kept you too long, and I do apologize. Y'all got to say time. Somebody put the X symbol up when I've just gone way over. I'm so sorry. Let me talk a little bit about different types of the difference between psychotherapy and counseling. Counseling is usually going to be short term. You're going to go in there with a specific problem, and it's going to be some set amount of time that you and the therapist will agree upon, that you all will have that relationship. Okay. Usually there's something specific, death of a loved one, or you're just, thank you, Priscilla, or you're just trying to get over a certain particular thing. COVID has been a stressor for a lot of us. People are trying to adjust to working from home. People are trying to adjust with, oh my God, the worry of, am I going to get sick, get COVID, and die? That's a real concern. And so you have some people who take it to one extreme and that they don't leave their houses. Everything is delivered in. They hadn't seen daylight except to peep out through shades. On the other extreme, you have people that say, que sera, sera, as my mama tell me, and they are living their lives. Okay. And so, that may be something for their loved ones who are very worried about them to have to cope with. And so you may find that that is a very specific thing that you just need, to get through. Thank you, Auntie, for not looking at the clock. I feel bad. You may just find that that is a very specific thing that you need to get through. And so you don't need to be, in deep psychotherapy, just something to help you cope, to develop some coping skills and strategies. And then you and your therapist part ways, for life, for eternity, or maybe until the next significant stressor comes your way. And that's okay. Now, psychotherapy. Okay, there are a couple of different types of psychotherapy, about 4 or 5. What most people are usually going to be doing is behavioral or cognitive. Now, when we talk about cognitive psychotherapy, we are talking about the way that you think impacting your behaviors. So if I think that every time I cross over a bridge with water, I'm going to fall in, that's going to mean that I will likely never drive over bridges. And so it's going to take me a long time to get places. Okay. So if I can change your way of thinking, if I can change your cognitive way of thinking about bridges, then I can get you to drive over them, thereby decreasing your travel time. Get that? Just that easy. That's all cognitive therapy is going to be interested in doing. Now, that seems really interesting. But imagine someone with, for example, an anxiety disorder. We use a lot of cognitive therapy in anxiety disorders and people who have anxiety disorder. Now, what I do as a child and adolescent psychiatrist is a lot of behavioral therapy, behavioral modification, or even parent training, we may call it. Now, my auntie, Brandi B said, what about anger management? And so with children who have anger management, a lot of whom may have oppositional defiant disorder, as I talked about I think 2 weeks ago, we used this modality with them. And you may remember that I talked about behavior charts. So we use behavior charts in child and adolescent psychiatry, where you have the kid to do 5 tasks, and if they do 4 out of 5, they get a reward on a daily basis or a weekly basis or a monthly basis, depending upon how old the child is, how mature they are, and how much they understand time and rewards and that sort of thing. It's the same thing that you use on your job, though, when you clock in. A time clock is a behavioral modification tool, okay? If you're late, your pay gets docked. If you're late so many times, you're going to have to go in to see the boss. The boss is going to first give a verbal, then a written, and then they're going to look at terminating you. These are all behavioral steps. So we are doing something, either a reward or a punishment, in order to get you to change your behavior. Same with kids, okay? Some people use spankings, and again, DHR has guidelines on spankings. You can't leave a mark. But I always tell parents, if spanking is effective and you've done it not out of anger and in accordance to the guidelines that DHR has set in your specific town, city, county, or governing body, and it works, then great. It worked for me. Don't tell my mama, but I got them, and it worked. I didn't like getting spankings, okay? But if it's not working, it's frustrating for you, and the poor kid is getting spanked every day. So go ahead and go to something else. Behavior modification, it works in casinos. Hi, Dr. Jamila. Thanks for joining. It works in casinos. Behavior modification works in casinos. What happens? And there's several things that you can do. There's intermittent behavior modification. There's ones where it's guaranteed. Casinos work on an intermittent fashion, right? So you put money in, put money in, put money in, don't win, don't win, don't win, then win. That win reinforces your desire to go back and do it again. And nobody knows what it is. It's intermittent. So I could put in 5 times win, and then the next time, 10 times win. Well, now I'm sitting there and I'm prepared because I know I could go as much as 10 times, but they may hit you with a twice and win, okay? But regardless, something enjoyable comes out of it so that you keep doing it. Likewise, when we're talking about anger management, that's probably going to be in large part doing some therapy, okay? And there are going to be specific folks that could target that anger. A lot of times when people have anger management, anger stems from irritability, all right? And so irritability is the root of so many things, both in my pediatrics world and my mental health world. Irritability can mean ADHD. Irritability can mean depression. Irritability can mean I'm too hot if it's a baby. Irritability can mean I'm hungry if I'm a toddler and I cannot quite talk. Irritability can mean anxiety. Irritability can mean psychosis. You're hearing and seeing things. So voices are always in your head, and so you're just lashing out at people. So anger management, we probably need to get to the basis of why are you angry? What else is going on that can make you so angry? You could be irritable because you were traumatized, sexually abused by your dad, and had a baby by him when you were 16 that you were forced to give away. You could be irritable because of that. And so every time you see an adult male, even into adulthood yourself, you still become angry. So there is usually something underlying that anger that we need to get to the root of. And so that's going to be a part of your therapy as well. All right. Let me just hint on this. Reverse psychology. Nobody's trying to do that on you. Nobody's trying to do that. If we're telling you to do something and it falls upon you that, oh, they use reverse psychology on me. And so I looked it up. And it is, doing the opposite of what someone suggests that you should. So if they suggest you should go to the mall and you say, well, fine, I'm not going to go. Okay, well, fine. You didn't go and you probably need to spend the money. All right. Okay. I don't see any questions coming in. I do appreciate you all for joining me. Hi, Gerald. Hi, Ashley. Thank you all for joining. Hopefully this was very, very, very helpful. I kept you all much longer than I intended to, but this is good information. I want you to take away a couple of points. Psychiatrists are physicians. All right, we got that. Psychologists get the gist of medicines, but they cannot prescribe it, okay? Mental health, it's good. It's good, okay? Mental health, I'm going to just go out on a limb and say this. Our minds control so much about what goes on in other places. People talk about mind over matter. Well, if your mind ain't right, the matter can't be either, okay? So make sure that your mind is right. It is completely okay to have God and a therapist. It really is. Read your Bible with your therapist. In fact, there are counselors and therapists who are religious, are a part of religious-based organizations. Seek them out, okay? Seek them out and see them. Again, being in a relationship with a mental health professional is just that. It's a relationship. I once had a man told me he really liked me, but he didn't like my voice. And I told him that I sounded just like my mother before me. And I liked him too. But we were not going to fit because there was nothing I could do about my voice. And we parted ways. And I was okay with him leaving. Don't be afraid to ask for second opinions. I'm perfectly happy when my patients want one. In fact, I help them locate somebody that can help them. If you want some psychological testing, get it. Confirm the diagnosis. But don't be selfish. If you have a child who is struggling, and you know that child is struggling, whatever it is, depression, anxiety, ADHD, all of the above, something else, please get treatment for that child and get treatment for yourself. I have just started flat out telling my family members, please go get some therapy. And that is because nobody thinks you're crazy. I don't even know what crazy is. I just want you to be better. If you're dealing with the loss of a loved one, the loss of a pet, the loss of a job, if coronavirus is stressing you out, if just listening to me makes you stressed out and you feel relieved because you can't wait till Fridays at noon to hear this Focus on It Fridays, I'm glad that I can help you, but please allow me to just be the doorway, the entryway, to encourage you to seek out someone who can help you on a more individual basis. All right. I love y'all so much. Y'all hang out with me on Fridays. Y'all are my fan club. Y'all are my fans. I really appreciate you all because you could be doing a lot of things on a Friday at noon. But I am so glad that you're here with me. If this video suits somebody, just inbox them. You don't have to tag them. They may be embarrassed. They may not want anybody to know. But I'm glad that you're here watching. Share it with them. Let them know. Share it on your pages. Just say, hey, somebody may need to hear this. Go ahead and help me out so that I can get the word out. I love you, Auntie. Thank you so much. Thank you, Priscilla. I love y'all. Y'all are just so special to me. So again, I am Dr. Brandi B. I'm going to get out of here. Let y'all get back on with your day. I'm Dr. Brandi B, your triple board certified child and adolescent psychiatrist. I help worried, overworked, overwhelmed, plain old tired moms who have kids with ADHD and any other mental health disorder gain the empowerment, the encouragement, and the education that they need so that they can help their children behave, be well, be seated, and be successful in the classroom and in life. I love y'all to pieces, and I will see you all next Friday on next week's episode of Focus on It Friday. Have a good weekend. Wear your masks, wash your hands, and be safe. Bye-bye.